Welcome to the Brushing Up on Mouth Care Education Series. In this series, we are focusing on personal daily mouth care for older adults. Many older adults experience a decline in physical and mental health as they age. This often leaves them dependent on others to assist them with their personal care needs. There are 5 learning modules in this series that relate to the various aspects of providing daily mouth care. This is module number 3, Considerations for Dementia. In this session, we will review Understanding Dementia. What is dementia? Prevalence, types, and symptoms. The most common losses of dementia. The 7 A's. Responsive behaviors. Tips and techniques for providing oral care. Please note that this educational video was developed for use in long-term care, and therefore the term resident is used throughout to describe the recipient of care. However, this information is also valuable to those providing care in other settings, such as home care and acute care. In these instances, please take the term resident to mean client, patient, loved one, or whatever term best describes the person you are caring for. Understanding dementia. What is dementia? Dementia affects one of the most important areas of the body, the brain. The brain is responsible for a person's intellectual and cognitive functioning. Any loss of these functions due to dementia will affect how a person interprets, interacts with, and responds to their social and physical environments. This disease can have a profound effect on a person's day-to-day functioning and relationships. Dementia can be a very frustrating disease for family and friends. As the disease progresses, people with dementia find it difficult to work or participate in normal daily activities. This is a progressive and ultimately terminal disease. People may live with dementia and its associated symptoms for 20 years or more. The cause of dementia is still unclear, and it is believed to be the result of a combination of factors, including family history, lifestyle, and environment. Non-modifiable risk factors include age and genetics, while some modifiable risk factors include type 2 diabetes, head injury, strokes and mini-strokes, high cholesterol levels. Therefore, living a healthy lifestyle, including healthy eating, physical activity, and minimizing stress, could prevent or delay the onset of dementia. Prevalence of dementia. Canadians today are living longer than ever before. As the baby boomers age, we can expect to see a spike in many age-related chronic diseases, such as heart disease, arthritis, cancer, and dementia. In 2008, approximately 500,000 Canadians, or 1.5% of the Canadian population, were living with dementia. By 2038, 1.1 million Canadians, or almost 3% of the population, will be living with dementia, and approximately 258,000 new cases will be diagnosed each year. Cognitive impairment in aging, including Alzheimer's disease and other types of dementia, affects 1 in 4 Canadians over the age of 65. This rises dramatically to 2 out of 3 Canadians over the age of 85. In Canada in 2008, 231 million hours of informal care were provided to people with dementia. And by 2038, that number is expected to rise to 756 million hours per year. Types of dementia. Alzheimer's disease is the most prevalent form of dementia, representing approximately 63% of all dementias. The second most prevalent form of dementia is vascular dementia, making up about 20% of all dementias. Other related dementias include Lewy body dementia, frontotemporal dementia, Creutzfeldt-Jakob disease. These dementias occur in combination with various chronic non-dementia conditions, such as Parkinson's disease and Huntington's disease. Symptoms. As dementia progresses, brain cells will lose the ability to function properly. This loss of function will present in a number of different ways. Common symptoms of dementia include memory loss, confusion, changes in behavior and personality, difficulty organizing everyday tasks. Depending on the type and severity of dementia, other symptoms may present. Symptoms of dementia often worsen over time. While there is currently no cure for dementia, there are medications that may help slow its progression. The 7 A's. When you are caring for someone with dementia, it is important to remember that the disease affects the person's memory, language, problem solving, and self-awareness. Often their reality and experience of the world around them is not the same as yours due to the changes in cognition. It is important to remember that their reality is as real to them as yours is to you. The 7 A's provide a tool to help us to understand the losses of dementia and are intended to help us better understand the meaning of behavior. ANOSOGNOSIA. No knowledge of their illness or disease. In the resident's mind, they are not sick and do not require help. Their insight is impaired, and they are acting on the information provided to them by their brain. Their brain may be providing them with information from the past, when they were independent and able to take care of themselves. They are acting upon this information as if it's happening in the present. For example, they may become angry with caregivers trying to provide care, not appreciating they need assistance. Amnesia. Loss of memory. Memory is lost in reverse, meaning the last thing learned will be the first thing lost. This is why people with dementia can struggle to remember what happened this morning, but have no trouble remembering information from many years ago. So while people with dementia can no longer consciously learn, they can unconsciously learn by doing the same things every day. This reinforces the importance of a routine. For example, you can lay down a memory trail by performing oral care after meals. Aphasia. Loss of language. People with dementia can sometimes struggle with the expression of language, or comprehending what is being said to them and processing verbal instructions. They may forget words or have difficulty expressing their needs. It is important to be in tune with body language cues and to be patient as they try to express themselves. For example, speak slowly to the person when engaging them in the task of performing oral care and provide visual cues, like a toothbrush, to indicate what is about to take place. Agnosia. Loss of recognition of people, objects, and sounds. Even though you may provide care to a resident every day, they may not remember who you are. Mirrors may be distressing for these residents, as they may not recognize themselves. It is important to introduce yourself each time you interact with them and tell them what you are there to do. The resident may also struggle to recognize common objects, such as a toothbrush. In this case, it is important to put yourself and the object into context. For example, performing mouth care in the bathroom and running the water. Apraxia. Loss of purposeful movement. People with dementia often lose the ability to plan, sequence, and execute multiple steps of a task. Think about all the steps involved in brushing your teeth. A person experiencing apraxia may require simple instructions to break down each step involved in brushing their teeth. You may have to demonstrate each step in brushing your teeth. Don't assume that they can remember to do it at all or place it in the right sequence. Altered perception. People with altered perception are no longer able to see the world in 3D. Depth perception is altered, resulting in changes in the way a person moves about their environment. For example, clothing on a chair is perceived to be a person, or a mat on the floor is perceived to be a hole. The resident may also ignore their peripheral vision field and focus on what is in front of them. They may startle easily when approached from behind or from the side. Apathy, loss of initiation. Residents experiencing apathy may no longer have the ability to initiate conversation or involvement in activities, but will do so if someone tries to engage him or her. Keep this in mind when attempting to provide oral care. Initiate the activity of brushing the resident's teeth, and they may be able to complete the activity on their own. Changes in behavior as a result of these losses are common. It is important to take a step back, try and understand what you are seeing in the person's behavior and why the person may be behaving in this way. With this understanding, it becomes easier to develop an individualized approach for each resident in how you provide oral care. Responsive behavior. Often people with dementia can act in ways that appear to be unpredictable or unexpected. Remember, when a person begins to experience a decline in cognition, the brain's ability to process information and appreciate what is happening in the environment decreases. As the brain loses its ability to process information, the person relies heavily on cues from the environment and reacts without the ability to think through a situation or problem solve to determine appropriate actions. Behavior can be triggered by things in the resident's physical or social environment, or by something going on intellectually. For example, loud noises or inadequate lighting can be triggers in a person's physical environment. Mirrors can also be distressing if the person does not recognize their own reflection. A person's social environment consists of the people in their environment and what they are doing. Responsive behavior can be the result of the resident's reaction to others in their environment. For example, someone talking loudly, tapping their foot, or laughing could cause the resident with dementia to act negatively. Care staff need to be mindful of their approach to a resident as well as what other people in their environment are doing. Intellectual triggers would be associated with the 7 A's we reviewed in the previous section. Also, dementia often affects the part of the brain that controls threat perception, the amygdala. When this happens, it becomes difficult for the person with dementia to distinguish between threatening and non-threatening situations. They may misinterpret the actions of others. Therefore, people with dementia may have a fearful reaction to a non-threatening situation, such as someone attempting to brush their teeth. Remember, if a resident with dementia perceives their environment to be threatening in any way, it will be more difficult to provide care. Be sure to provide an environment that is calm, quiet, and positive. This type of environment will make a resident more receptive to most types of care, not just oral care. Tips and techniques for providing oral care. Oral care is sometimes low on the list of priorities when it comes to resident care, not because it is unimportant, but because it must compete with many other essential daily tasks. Care staff may find it unpleasant providing daily oral care because it invades the resident's personal space, and they are sometimes unsure of best practices. Care providers often face additional challenges when attempting to provide oral care to residents with dementia, due to possible memory loss, lack of communication skills, lack of motor skills, or behavioral concerns. Given that oral care plays an integral role in overall health, It is important to make oral care a priority every day. Remember, poor oral hygiene can lead to bad breath, cavities, swollen and tender gums, and loose teeth. Oral pain and discomfort can make it difficult for the resident to chew their food, which will affect their digestion and ultimately result in poor nutrition. In some cases, poor oral hygiene can be a factor in the development of heart disease, stroke, and pneumonia. In this section, we will outline how care providers can use verbal and nonverbal cues and other techniques to assist people with dementia with their daily oral care. Often people with dementia are perceived as being unable to perform their own oral care. However, with some guidance, changes to their physical or social environments, or modifications to their oral health tools, some people may be able to overcome the challenges associated with dementia and complete oral care activities by themselves. It is always best to allow a resident to complete his or her own care if possible, even if you don't feel they are doing a sufficient job. Adherence to daily oral care practices is more likely when the resident is involved with their own care. As a care provider, there are a number of things that you can do to assist your residents with their daily oral care needs. Residents with dementia often provide a special challenge. It is important to consider the timing of oral care, communication strategies, positioning, etc. Here are a few tips for providing daily oral care to residents with dementia. Timing of oral care. Set a routine time and place to provide oral care. The familiarity of a routine may decrease resistance over time. Provide oral care after a meal. At this time, residents are usually more relaxed, calm, and may be more willing to have oral care done. Do not wake a resident to provide oral care. This may increase confusion and lead to resistance or responsive behavior. Setting up. Gather all the necessary supplies ahead of time, and if possible, always do oral care in the bathroom. This environment will help to serve as a cue for oral care. Check the resident's physical environment. Is something preventing the resident from performing their own care? For example, the resident may have trouble reaching the sink or seeing themselves in the mirror. If there are concerns, try to think of possible solutions. Use a kidney basin if they can't reach the sink. Provide a hand mirror if they need to see while doing oral care procedures. Make sure the environment is calm and quiet with few distractions. For residents that are easily distracted, close the door during oral care. Ensure all oral care supplies are labeled, including the resident's toothbrush, dentures, and denture brush, in case they go missing. Allow residents to participate in their own care as much as possible. They may need assistance with setting up, cleaning up, turning the water on and off, or putting toothpaste on the brush. They may also need guidance with brushing and may need verbal cues to rinse and spit. Communicating with the resident. Always approach with a smile, which provides a positive cue to the resident as the activity is initiated. Identify yourself and say what you are going to do. The resident may have forgotten. Use short sentences and simple words. Speak slowly and clearly. Ask only one question at a time and provide only one instruction at a time. Communicate with the resident in other ways if their speech and ability to understand are limited. Use nonverbal cues such as smiling, gentle touch, or having the resident hold their toothbrush while you set up. Always use a positive approach. Start by showing the resident what to do, and then coach and encourage them to do the same. Break down the oral care process into small steps. For example, Step 1. Place the toothpaste on the brush. Step 2. Place the brush in their hands. Step 3. Place the brush in their mouth, etc. Give lots of praise and positive reinforcement, remembering again to use short sentences and simple words. You may have to distract the resident in order to provide oral care. For example, you may want to sing or count or provide the resident with a toothbrush or a face cloth to hold while brushing their teeth or dentures. Always encourage the resident to participate in their own oral care if possible. Positioning while providing oral care. If the resident is sitting in a wheelchair or in bed, make sure you position yourself so that you do not cause strain or stress to your back and neck. Ideally, if the resident is sitting, you should stand beside or slightly behind the resident. This will give you better access to the mouth. Stabilize your hand by resting it on the chin and pull the lips open with your thumb. If you feel any mechanical stress, change your position. You may also be able to lean the wheelchair back. If the resident is lying in bed, you can either sit or stand beside the resident's head. This allows for more visibility and less neck strain. While this position is ideal for preventing neck and back strain, it may not be appropriate when providing care for someone with dementia. People with dementia often lose peripheral vision. Therefore, positioning yourself beside or behind the resident may make them nervous, confused, or uncomfortable. In this case, it would be best to position yourself in front of the resident to provide oral care. If the resident is sitting, approach at eye level to appear less threatening and always approach with a smile. Providing daily care. If a resident is resisting oral care, never force them to have this care done, but set up the oral care supplies anyway. Use verbal and nonverbal cues to encourage the resident and talk about the importance of good oral health. If resistance persists, note what was done and if there is a particular time when the resident seems to be more receptive to care. Remember to try every day, even if not successful. Set a routine and continue to try. If you are having trouble getting the resident to open their mouth, try first to verbally coax them to open. If difficulties persist, try massaging the cheeks over the TMJ area to relax the muscle and encourage opening. The TMJ is the joint connecting the lower jaw to the skull on either side of the head. The joint is located just in front of the ears. If a resident is clenching or closing their mouth during oral care, you can try using a mouth prop to gently hold the resident's mouth open while you brush their teeth. Mouth props can also provide peace of mind to care providers who are fearful of having their fingers bitten when providing oral care. Mouth props can be labeled, cleaned, and reused. To use a mouth prop, wiggle the prop between the back teeth, then turn the prop so the wider portion allows the mouth to open more. If a mouth prop is unavailable, you can use several tongue depressors taped together or the handle of another toothbrush to prop the resident's mouth open. This is called the two-toothbrush technique. It is advisable to wipe the mouth with a non-glycerin oral swab or face cloth to remove excess food debris that accumulates in the resident's mouth before brushing with a soft toothbrush. Make sure to look inside the resident's mouth for anything different than the day before. Feel for any lumps or swellings and note any changes. If the resident is refusing oral care, it could be because they are in pain, so make sure you check their mouth for any potential sources of pain. If the resident has a tendency to swallow toothpaste, use only a pea-sized amount. Fluoridated toothpaste is beneficial for cavity prevention. If the resident has difficulty swallowing, use a non-foaming toothpaste or simply moisten the toothbrush with water or non-alcoholic mouth rinse. Removing dentures is sometimes difficult, but very important to do. Full dentures and partial dentures should be removed and cleaned every day. If possible, have the resident remove their own dentures. Otherwise, place your finger at the back of the resident's mouth, along the side of the back teeth. Loosen the upper denture by gently prying it downward, or the lower denture upward. The upper denture is usually the hardest to remove, but once the suction is released, it should come out easily. If a denture appears to be stuck and is very difficult to remove, seek the assistance of a dental professional. Always clean dentures over the sink. Line the sink with a wet face cloth or fill the sink 1/4 full of water. Hold the denture firmly between the thumb and forefinger of your non-dominant hand. Rinse the denture to remove any loose debris and saliva. Remove any denture adhesive materials that remain on the denture and thoroughly brush all surfaces of the denture. Use liquid soap or a foam denture cleaning product. Never brush with toothpaste. Toothpaste is abrasive and will scratch the denture surface. Once cleaned and rinsed, dentures should be soaked for a minimum of 30 minutes. Home support staff may consider starting their visit with oral care so that dentures will have adequate time to soak while they complete other care tasks. Soak dentures in denture cleaning solution. If commercial denture cleaning product is not available, dentures not containing any metal parts can be soaked in a mixture of 1 teaspoon bleach and 1 cup water. Doing a quick brush without soaking the dentures may not provide the disinfection they require. Rinse denture thoroughly before placing back in the resident's mouth. Remember, you'll want to put a clean denture back into a clean mouth. It is important to brush the resident's mouth with a soft toothbrush to remove debris and stimulate gum tissue. Always encourage the resident and use positive reinforcement. Do as much as you can each day. While you may not accomplish everything every day, you should always attempt to do oral care with each resident daily. Even if you are not successful, the cues are being established and the routines are being set. Make sure to record all difficulties and successes. Other techniques for providing oral care. Some of the difficulties associated with providing care to residents with dementia stem from responsive behaviors. Remember that all behavior has meaning, and the resident is using behavior to communicate with others. These behaviors often arise when a resident is tired, does not feel comfortable, or does not understand what you are doing. Responsive behaviors include both physical and verbal resistance. For example, turning their head, clenching their teeth, pushing the care provider away, or verbalizing their resistance. Get out of my room, or get away from me. In these instances, it may take a little something extra to ensure the resident receives adequate oral care. We will now review some other techniques you may wish to consider when faced with additional challenges. These techniques should become part of your day-to-day approach to providing oral care to residents with dementia. Hand-over-hand technique. The hand-over-hand technique allows the resident to feel as if they are providing their own oral care. The care provider places their hand over the resident's hand and guides them through the brushing procedure. Chaining. Chaining goes a step beyond the hand-over-hand technique. When a care provider starts the oral care procedure, and then the resident takes over and finishes the process, this is referred to as chaining. The care provider can place toothpaste on the toothbrush, place it in the resident's hand, and assist the resident to place the brush in their mouth and brush their teeth. Once the care provider feels the resident is in control of the procedure, they can let go of their hand and allow them to finish brushing on their own. Distraction method. The distraction method is used to distract the resident while oral care is being provided, especially if they are not happy about having it done. The care provider can sing, hum, talk, or gently touch the resident. If the resident is grabbing at things with their hands, give them a face cloth to hold in each hand to keep them busy while you perform their oral care. Bridging technique. Bridging is a variation of distracting. Bridging occurs when the resident is asked to hold the same object as the care provider, such as a toothbrush, and then holds this object while oral care is being performed. Rescuing. This is when a care provider is experiencing difficulties with a resident, and a second care provider comes in and relieves them from the situation. The resident is told that the second care provider is there to help them out of the stressful situation. This may encourage the resident to like and trust the second care provider. The second care provider will then take over the oral care procedure from the first care provider. In situations where a second care provider is not available, you can excuse yourself, step out of the room, return a minute later, smile, and introduce yourself. The resident may not remember that you were already there and may be more receptive, thinking you are someone else. Conclusion. We must remember by the year 2038, approximately 3%, or just over 1 million Canadians, will be living with some form of dementia. We must also remember that more Canadians are aging and retaining their natural teeth, which will increase the importance of supporting and providing adequate oral care. Increasing awareness and knowledge on this subject among administrators, care staff, residents, and their families will be key. While oral care for those with dementia may not be possible every day, it is important to keep trying. A resident who often refuses oral care may see your continued attempts to provide this care and eventually accept oral care as part of the routine you have established. Be sure to include residents in the oral care process as much as they are able. We hope that by using the techniques outlined in this education session, you will have a more positive experience in providing oral care to residents with dementia.
Let's test your knowledge. Aside from age, the biggest risk factor for Alzheimer's disease is A. Smoking, B. Family history, C. Stroke, or D. History of concussion. The answer is B. Although all of these may be risk factors for Alzheimer's disease, family history is the most significant. Besides memory loss, people with dementia are expected to experience A. Yelling and aggression, B. Confusion and difficulty organizing daily tasks, C. Hallucinations, or D. Headaches and blurred vision. The answer is B. Confusion and difficulty organizing daily tasks. Although people with dementia can appear to be aggressive and uncooperative, it is believed that this is a result of frustration and confusion. Inability to plan, sequence, and execute the steps for brushing one's teeth is most closely associated with A. AGNOSIA, B. ANOSOGNOSIA, C. Apraxia, or D. Altered perception. The answer is C. Apraxia. Apraxia is one of the 7 losses of dementia and refers to an inability to perform particular purposeful activities. Loss of insight, or ANOSOGNOSIA, is associated with all of the following changes except A. Inability to remember close relatives, B. Resistance to care, C. Repeating the same question, or D. Impulsive verbal behavior. The answer is A. Inability to remember close relatives. This loss of memory is linked to amnesia, whereas anosognosia typically refers to an altered sense of reality.